We are learning lactation today. It can be asked as a full question or short note. First studying is phases of lactation. So there are 4 phases. Memogenesis, starting from birth up to proper lactation. So preparation of breast milk for milk secretion. Now lactogenesis, synthesis and secretion of milk. Expulsion of milk, galactokinesis. This is specifically oxytocin action. Okay. Maintenance of lactation. So after childbirth, you have to over and over again and again produce and secrete a milk. This is called galactopoiesis. Now hormonal regulation of lactation. Books hasn't mentioned this. You don't forget to write about hormonal regulation. So estrogen, progesterone, growth hormone, insulin and thyroid, all hormonal essential for all stages. Okay, memogenesis, lactogenesis, galactopoiesis and galactokinesis. But there are some key hormone for various stages, like prolactin is always needed for galactopoiesis. Okay, so after childbirth, prolactin is very essential for galactopoiesis. No prolactin, no milk secretion. And without oxytocin, galactokinesis was not possible. Some other points. Memogenesis, from birth until pregnancy, breast is developed. Okay, that is called memogenesis. Now during pregnancy also there is a little bit milk secretion. Okay, breasts are being prepared for milk secretion after delivery, but due to suppressive action, hormone estrogen and progesterone, they are secreted by placenta. So prolactin is inhibited. So no free flow of milk. But just after delivery, placenta is shedded outside the body. So what happens? Sorry. Placenta is shedded outside the body. So what happens? Inhibition by estrogen, progesterone grown, prolactin free flow, milk free flow. So first is colostrum secreted, very scanty amount, 500 to 750 ml per day, and slowly in next 1 to 7 days the breast begin to secrete a milk instead of colostrum. Now 3 types of human milk. The nature and composition varies with postpartum period. 3 types. Colostrum is a deep yellow color fluid secreted by the mammary gland during first few days of postpartum period. It is a high protein diet, 8.5 gram per deciliter protein in it, rich in immunoglobulins. Okay, immunoglobulin A specifically lining the ducts. Lactoferrin, which is a very good absorbable ion in granular bodies. Colostrum corpuscle, they are loaded with fats. Okay, this fat is easily digestible for babies. Now also smoothies the GIT of baby. Okay, transition milk or intermediate milk. It is secreted from 6 to 15 days of postpartum period. So up to 6 day colostrum, and now colostrum is slowly changing into mature milk. Ready? So mature milk is around 15 days and onwards until mother carry intended to breastfeed the baby. Now, rather than going for advantages and composition of milk, you write about milk rejection reflex first. Okay. Now baby sucks at nipples and areola. So afferent somatic nerves, spinal cord to hypothalamus. Ready? Posterior pituitary releases. So hypothalamus tells posterior pituitary to release oxytocin and anterior pituitary to release prolactin. So under effect of these 2 hormones, under effect of prolactin, alveolar cells produces and secrete milk, and effect of oxytocin is on myoepithelial cell to milk expulsion, contraction of myoepithelial cells. So milk is pushed outside duct into mouth of baby. Now you have little bit covered the milk ejection reflex. Now you go on composition of human milk. 88.5% water, 11.5% solid, and both organic and inorganic thing. Now you remember, this is the composition we will see the composition in detail. But modern trend is now about formula milk, but formula milk, it doesn't cover the immunoglobulins, the neutrophil cells, the protective cells secreted by mother. Formula milk don't have that. And cow milk is worst. First, there is a chance of tuberculosis in a cow milk, and infection and sterility, and also the composition is not good, so not advisable. In India, it is a very common practice to give baby cow milk. Okay, so now as you can see, the composition of colostrum, mature, and cow milk. If you can remember, well and good. If you can't remember, don't worry, just go on advantages of breastfeeding to the baby. Ready? Balanced diet, it changes according to the need of baby. Even according in summer and winter, the composition changes. In summer, it is having more water for baby. Okay, initially it is having more watery, and when baby is finishing after 15 to 20 minutes from one breast, it is having more fat. So even in one round, when baby is sucking in one feed, also the composition is different in initially and in last. So human milk contains protein, carbohydrate, fat, mineral salts, and vitamins. Ready? It is a natural balanced food for the newborn. Now colostrum, also the mature milk, colostrum particularly should be given. It is a 1 mark comment asked. Why colostrum is having very good amount of immunoglobulin A, neutrophil, the lactoferrin, and the corpuscle macrophages. Yeah. Yes. Now human milk is easily digestible, protein component and everything is according to the need of a baby. Also, it has a very good source of calcium, lactoferrin. Iron is in a friendly form, so it is more absorbed from human milk. Okay. It has also lipase enzyme which assists in lipid digestion. Growth factors. Growth promoting factors like epidermal growth factor, insulin, and somatomedin C are present in the human milk. And it is sterile. You don't have to worry for infection. Is if you are keeping your breast clean, then you don't have to worry. And it is at right temperature. Now, advantages of breastfeeding to the mother. First is lactational amenorrhea. So prolactin is inhibiting the luteinizing hormone FSH. So no ovulation and no menstruation. Second is involution of uterus. So whenever baby is sucking, oxytocin is being released during each session of breastfeeding. So it also acts on the uterus and help it contracting involute. Okay. So proper involution, protection from infection. Second is protection against breast engorgement and breast infection. If you are not breastfeeding, so your milk is getting stagnant in breast, chances of bacterial infection, and it is very painful. Yes, so much fat is released in breast milk, so protection against obesity, emotional bonding, yes, and psychological satisfaction enhanced by breastfeeding. Why? Because it is releasing oxytocin so much, and protection against breast cancer.